That's probably why we're here. Yeah. Right. Let's really catch it on.
Yeah.
And it'll be like,
yeah. And you just walk around and just like the Japanese parties. I have these. I don't know if it was true.
you guys don't have this. I mean, it's
That's the.
Like looking at the Japanese gardens and walking around there.
Oh,
But this is where I thought.
I see this looking at the computer.
It's very nice.
A pop-up did come. I mean,
Yeah, there's a lot more traffic though than
wow. Oh, sure.
like we go the highest cars and we think it's
Right. Well, it's just changed. Yeah, and then the turning. Again, it's living in this area. So it's pretty busy. Right. Yeah.
I think we're there. They're telling me if this is all right. Can you hear me?
I can hear you about the phone.
We're still not coming out the right microphone. Hang on a second, we'll do that again.
I'm always saying to my buddies who live in Quality, I said, if your pharmacist is a friend, I said, as soon as I see the doctor, then I would go to my pharmacist. With this.
It's shitty broadcast.
And we talked about it. I said, this one's for our age, but these are guys. We make sure it's people there. It's also, but I don't know where it came from.
Right. I think we're in business. We're gonna start. So first of all, I say good afternoon. I'm Doug Jones. I'm the president of the Vancouver Island Chapter 19 of CARP, and I welcome you all to this, our first hybrid chapter meeting, which I hope is going out well to those who are both present, who are here in this beautiful Esquimalt Pavilion in Gorge Park, and to those who are listening simultaneously on the webcast, as well as those who will be coming in later and looking at it on the YouTube channel. So this will be the first time we've done a webcast, and I'm hoping it's coming through well to those of you who are not physically in the room. We, of course, are physically located for the chapter across all of the islands in the Vancouver Island region. So we acknowledge and respect the many First Nations of Vancouver Island and the Canadian Gulf Islands of the Salish Sea, on whose traditional territory CARP Vancouver Island Chapter operates, and their peoples, whose historical relationship to the land continues to this day. So thank you to all of you who've answered our survey, one of which said you wanted to meet in person. So we're starting this meeting in person part, and welcome to all of you who are here. It's a new venture for us in doing this hybrid type meeting. There are a few glitches that we get all our equipment set up and get things running, but I really appreciate the fact that you've answered the survey, and the first two of our hybrid meetings, the topics of which were picked specifically for the two top topics coming from that survey. So that was very helpful for us as a board as we move forward on that one. So a little housekeeping, first of all, is for those who are online, let us know where you come from in the chat box. Just give your name and your location. Remember that we do have a Q&A session at the end, so you can type in your questions into the Q&A and we'll send them out as well to the speaker at the end so that we can answer the questions. If we run out of time for questions, we'll try to see if we can get some answers sent out to you individually if you include your email address in that. So this chapter meeting is being recorded, as I mentioned. It will be broadcast on the YouTube channel later, and we'll have information about that on the Facebook page, on the chapter Facebook page, for those who are not able to come. And so our chapter Facebook page is, of course, facebook.com/CARP Vancouver Island. Okay. And for those of us who are here, we like to hear from you. So our email address is just the vancouverisland@carp.ca. Certainly let us know what your opinions are, what your preferences are, because we're here to serve the membership, of which you are all members, about 4,500 of you actually. We'll end the meeting promptly at 4 because I promised we'd keep everything on time. For those of you who are here, if you want to get up and have some coffee or things at the back, by all means do so, and we'll have some goodies on the way out as well. So at this time, I'd like to introduce our speaker, Jeff Ho. And Jeff, as you probably read in the newsletter or on our Facebook page, is a local pharmacy manager from the Tuscany Mall, very close by me as well. Thank you very much to Michael Mew, Manager of Communications for the BC Pharmacists Association, and to Eric Lynn, District Leader for Rexall, for helping to arrange today's meeting and the speaker. I am very pleased that Jeff has agreed to be the speaker today to help us understand some of the aspects and the vital role that he plays in health management. And in particular, what he has given us in the way, or will be giving us rather, in the way of some of the new scope of practice that's going on now, and why that's vitally important for our health. As I mentioned, Jeff is a pharmacist in Victoria, graduating in 1990, and has spent the rest of his time in the Victoria area between Oak Bay, Collingwood, and Saanich as part of a healthcare team. He's told us that his goal is to help patients feel better and get well. When not working, Jeff enjoys cooking and watching basketball, something that a few of the rest of us here do as well. So please join me in welcoming Jeff to the podium to talk a little bit about the role of pharmacists in your healthcare. Jeff. Forward and back.
Okay. Thank you very much, everybody. It's not a bad day today. We have a nice surrounding area, so I hope today we'll have a very good meeting today. Okay, so today's presentation will be talking about some of the common drug therapy problems that we come across every day. We will talk about what is polypharmacy and medication reviews, what is medication review and its benefits. And also, we will talk about some of the most recent changes of the scope of practice for pharmacists in BC. So there are just a few topics, and we should go through them pretty quickly. So what are the most common drug therapy problems that we come across every day? So there's the list here. The first one, unnecessary drug therapy. So this can happen sometimes. One of the examples that I have is a very common medication called proton pump inhibitors. So it's a medication usually prescribed to treat various stomach issues, acid reflux, stomach ulcers. It's also prescribed off-label for people with chronic cough. Sometimes the doctors think that the cough is related to the acid reflux, and they may prescribe that for the person. So usually the doctor will prescribe it for initial treatment, and the patient takes it and they feel better. And however, in some cases, those patients will continue to take it every day. And in some of these cases, which is not necessary. So sometimes when we see patients, we see that they've been taking it for many years, and we'll suggest that, have you tried to taper it down and see what happened? And lots of them can do that, taper it off without any issues. So that's one of the problems. And also recent studies has found that if you take this medication for prolonged period of times, you can have other unwanted side effects. You can reduce the absorptions of some of the nutrients, for example, calcium. And in turn, if you have calcium deficiency, it may lead to osteoporosis as well. So that's something that we should watch out for. The second one, the wrong drug. So sometimes the doctor prescribes medication that there's no appropriate indication for the patient. So it may be a duplicate therapy that patients are already taking one of the medications that for the same purpose. Or maybe the doctor prescribed this to treat the side effects of another medication. Third one, dose too low or too high. So obviously, if the dose of the medication is too low, it's not going to help your medical condition at all. If the dose too high, you will run into problems with side effects. So one of the very good examples, thyroid supplement medications. So if the dose too low, it's not going to address your hypothyroidism. So you will still feeling tired. Some people may have depression as well. Constipation is possible. On the other hand, if the dose is too high, then you run into problem with palpitations, difficulty sleeping, tremors, feeling nervous, weight loss as well. So those are common issues with that. The fourth one, adverse drug reactions. Obviously, if the medication is not suitable for the person, they may have unwanted side effects from that. And also allergic reaction, it's possible. Inappropriate adherence. So this one is especially true when someone with multiple medical conditions taking multiple medications. So they may have to take medication at different time of the day, and then plus their vitamins and supplements. So it can make them feel quite confused sometimes of when to take which medications. And the last one, the additional drug therapy needed. So again, this is especially true for people with multiple medical conditions as well. For example, people that's on chronic diuretic medications, it may cause low potassium, and they may need to have potassium supplementations. So that the doctor needs to be addressed, and of course. So what is polypharmacy? So after we talk about those drug therapy problems, polypharmacy will be the next challenge. So polypharmacy, the definition is someone with chronic medications that's taking 5 or more chronic medications concurrently. And this can also include their vitamins and supplements as well. So for example, someone, very, very typical, someone with diabetes, cholesterol, hypertension. So they will be taking 2 or 3 medications for diabetes, a couple medications for blood pressure, 1 or 2 medications for their cholesterol. So they're up to about 6, 7 medications already just for those 3 conditions. And then if they have other vitamins and supplements, and if they have other conditions as well, like they may be taking an anti-anxiety medication or antidepressant medication. So that can add up very quickly. So someone with that can be taking like 10 plus medications per day. So with polypharmacy, what is the issue with polypharmacy? So the first very important one is obviously compliance. So earlier I mentioned about adherence. So compliance is same thing. So you have 10 plus medication that you have to take it multiple different times of the day. Plus, if the person has any kind of cognitive dysfunction, it will certainly add to the problem. We at the pharmacy can see that all the time, because if they don't refill their prescription for their blood pressure medication, like 5 months later for a 3-month supply. So you know there's something not right there. Okay. The second issues with polypharmacy obviously increase the risk of side effects. So each medication that have their own profile of side effects. When you have multiple medication add together, some of those side effects could kind of increase it exponentially. For example, blood pressure medication. So if you're taking 2 or 3 blood pressure medications, it may increase your risk of dizziness, lightheadedness, and that may cause falls and fractures. So that can happen quite frequently. The third issues with polypharmacy is drug interactions. So again, when you have multiple medications, the probability of having drug interactions certainly will increase, and which in turn will increase your side effects problems. And the fourth one is the increased burden on your caretaker. So your caretaker, when you have multiple medications taking multiple times, your caretakers will have to try to keep a very close eye on whether you've taken your medications already or not. So, phone calls, visits, that can happen. And so there are definitely some issues with polypharmacy. So how do we deal with the problems with polypharmacy? So one of the main one that we talked about a lot nowadays is called deprescribing. So deprescribing is it's a process that will try to tapering or stopping or discontinuing medications that is not necessary to manage your medical conditions. So usually your physicians, your nurse practitioners, and your pharmacists, they can work together and try to make a plan to reduce the number of medications that is required to manage the medications. So it is a process that's done through individually. Each patient has their own conditions and own issues. So it's only tailored to each particular patient. And one of the ways that pharmacists can help in this process is through the medication review. So that will bring up to our next slide. So what is medication review? So each pharmacy in BC can offer medication review service to patients. It is a government-funded free services for anyone that's taking 5 or more acute or chronic medications. And each patient is eligible for a standard medication review once every 6 months. And also we can do a follow-up, we call them follow-up medication reviews, and whenever there's a change of the medication regimen as well. So what do we do during a medication review? Any of you had a medication review of your pharmacist yet? No? Okay, good. Next time you ask your pharmacist. So first of all, the medication review is can be appointment-based. So you can set an appointment with your pharmacist, or it can be done when you are actually picking up your medications. But of course, it depends on the pharmacist's availability. So during this, it's a one-on-one meeting. So your pharmacist will sit down with you. Your pharmacist will have your medication history prepared. And then you'll sit down and then we'll go over each medication separately. So this will also include, when we talk about your medication, we also include your vitamins, your supplements as well, anything that you take basically every day. We will also confirm your allergies, your medical conditions, and we'll enter that into your file. Which each medication will make sure that you understand the name of the drug, the strength, and what's the purpose of the medication for. We want to make sure that you know why you're taking the medications, because once you know why you're taking the medication, you will take it. And also we'll confirm the time of the day that each medication is being taken. And so during the conversation, we'll also check with you that if you're experiencing any side effects from any of the medication, and we can certainly offer recommendations how to deal with side effects. And of course, if during the medication review, if there is any issues that we discover, that we can make recommendations to your physician. And then of course, your physician will in turn will look into that. And then if needed, they will make any changes in your medication regimen. In addition to, so once the medication review is done, we'll summarize all the information into the computer, and we can print out a report called Complete Medication History Report. So it's a report that will contain basically everything about you and your medications, your allergies, your medical history, or your medical conditions, and all the medication that you're taking. So it is an excellent report, because you can bring that with you when you have an appointment with a specialist, when you have an appointment with your dentist, or any other medical appointments. They will love to see that document, because it saves them a lot of time. Also, of course, if you do have to go to the hospital, bring that with you, because again, that will save the nurses and the emergency doctors a lot of time as well. So medication review is a very valuable free service that I think everyone should utilize. So yes.
So is that only available if you take 5 or more?
5 or more, yes. I mean, that's the government funded one. But of course, if you have, you've taken 4 medication and you want your pharmacist to go over your medications, we have no problem of doing that. Yes. So again, next time when you go to pick up your medication, ask your pharmacist if you can do a medication review, because I'm sure they will be happy to do that for you. And yeah. So next, I will be talking about the newest changes for the scope of practice in BC for pharmacists. So in September, I'm sure everybody had watched it on TV. In September 2022, the Minister of Health, Mr. Adrian Dix, had announced a whole host of changes that will expand the scope of practice of pharmacists. And it came into effect in October 14th of 2022. So the first one, injection certified pharmacists can now administer a wider range of medication by injection, provided the medication is prescribed by your physician. So this may include like vitamin B12 injection, people get maybe once a month, birth control injection for some ladies. So this, in addition to all the vaccinations that we have already been doing. We've been doing the shingle vaccines, your hepatitis vaccines, flu vaccines, of course, and the COVID vaccines, right? So we are allowed to do a lot more injections than before. Secondly, pharmacists can now renew a wider range of medications. We have been provided with the power to renew medication for a certain group of medication before for, I don't know, the last 10, 15 years maybe. But now the range is got wider. We basically can renew almost all medications, almost. Now, provided the medication has been stable for at least 6 months. So that means if you're taking a blood pressure medications for more than a year, and if there's no change in your dose and your blood pressure is stabilized, and if there's no concern, we can certainly renew the prescription for you if the prescription was written, the original prescription was written within the last 2 years. The expiry date of prescription now had changed from 1 year to 2 years now. Used to be just 1 year and the prescription will expire. Now it's 2 years. So that means if, say, for example, your doctor gave you a prescription a year ago for your blood pressure medications and your refill had run out, and so you come to the pharmacy or you phone to the pharmacist and say, my prescription refill had run out, and we can, we'll look at your file, look at your history, ask you some questions, make sure everything is stable, and we can certainly refill the prescription for you up to 2 years from the day that original prescription is written. But of course, there are situations that the pharmacist may not feel comfortable renewing your prescription. In those cases, we can certainly give you an emergency supply. We can give you a couple of weeks of emergency supply or 3 weeks until you can contact your doctor for follow-up or a new prescription. Pharmacists can also now adapt and modify the dose of the medication, the formulation of the prescription, and also make therapeutic substitution. So that means, for example, if you've been taking your blood pressure medication, say Ramapil 10 milligrams once a day, you went to see your doctor, the doctor gave you a prescription for Ramapil 5 milligrams once a day. So the pharmacist, after checking with you, making sure that there's no intention to change, and you've been on the 10 milligrams for a long period of time, and your blood pressure is stable. So once we confirmed everything that the change was not intention, then we can adapt the prescription without like phoning your doctor or faxing your doctor and then wait for your doctor to phone back or fax back. This will save lots of time. Once we've done the change, we will fax to your doctor and let the doctor know that's what we've done. We can change the formulation. So for example, if your doctor give you a prescription for a topical corticosteroid, but without entering what base should be used, like whether it's a cream base or an ointment base, we after talking to the patients, we can decide which base will be most suitable for the patient, and then we can adapt the prescription and change it to that formulation. And then again, we'll let your doctor know that was what we've done. Therapeutic substitution is an area where in the same group of medications, there are 5, 6, 7 medication in the same class of medication. We can substitute from one to the other if it's appropriate for the patient. So one of the examples is, again, for the PPI, the proton pump inhibitors. So if the doctor prescribed one of the proton pump inhibitors for the patient and is the most expensive one, and the patient cannot afford that. So within that class, there are different medications that will do same benefits. We can substitute that prescription to the less expensive medication. And we will, of course, let the doctor know that that's what we've done. So communication is always done through the pharmacist, between the pharmacist and the physicians, what we have done. So we won't do it just on our own. Okay, yes. Okay, so if you don't have a doctor, of course, we do have medical walk-in clinic this day, but those walk-in clinics is now more of an appointment-based clinic, so you can get to them. There's also online physicians that you can talk to. There is a new program by PharmaCare. It's called, if I remember the name correctly, I forgot the name. I was just reading that yesterday. So it's a program that if the person do not have a primary care physicians, and the pharmacist cannot renew their prescription for reasons that they may need to be follow up, they may need to have blood tests to follow up. So there is a form that we can fill out for PharmaCare to list out the medication that needs to be renewed. So PharmaCare, once the PharmaCare receive that form, they will, a pharmacist or a physician will phone the patient, and the pharmacist first will do a medication review and list out the medications, and then the physicians will follow up and with the patient, whether they need more follow-up blood tests before they would do the prescriptions for them. It's a new program. It just started, well, PharmaCare just announced that, I think maybe about 3 weeks ago or 4 weeks ago. I forgot the name, unfortunately, but if I come across that, I'll say that. But yes, so the idea is to make sure that no one will go without their medications that's needed.
It's just that when you were saying that the pharmacist will contact the doctor, well, if you don't have a doctor.
Yes, so if you don't have a doctor, so whoever the doctor that prescribed the last prescription is who will inform. If they retire, if the doctor have retired, then it will be another category, because once the doctor retires, the prescription becomes invalid. So in those cases, we actually cannot renew prescription. We can provide emergency supply. Yes, so there is distinction. Yes, if the doctor retire, even though before they retire, they give you refill for a year. So as soon as their license expire, those refills are no good. Yes, yes. Okay. So that's the scope of practice change. Oh yes, I missed that one. That's the one that's not in effect yet. So in the spring of 2023, pharmacists will be allowed to prescribe for minor ailments, including urinary tract infections and birth control pills. So minor ailments will be like hemorrhoids, oral thrush, conjunctivitis, allergic rhinitis. So those are minor ailments that has no serious consequences, but it's not in effect yet. It's coming in the spring, but up to now, we haven't heard too much about that. Yes, how it's going to be implemented, because pharmacists will need to go through some training before we can do that. So yes, that one is not in effect yet. So hopefully that should come into effect. As they say spring, so spring should be coming soon. But so far, yes, we haven't heard too much about that that expansion yet. So that's hopefully when that comes, I'm sure we'll be a lot more busier. We already have patients phone in that to ask, I have a urinary tract infection. Can I get an antibiotic from you? So we always say, no, I'm sorry. We have to wait 2 months. So that's but that's coming hopefully soon. Okay, so this slide shows the different provinces in Canada and the scope of practice for pharmacists in different provinces. So Alberta, you can see they have all the check marks. So Alberta is the province, the pharmacists in there, they can do a full scope of practice. They can prescribe independently for any Schedule I prescription medication. They can order and interpret lab tests. So they are way ahead of us in BC. BC, with the recent changes, we're catching on, but not quite yet. We still have a few things that we can catch up. the minor ailments and conditions that should be coming soon. Smoking and tobacco cessations, we have BC Pharmacare has a program that we can actually prescribe, well, not prescribe, but provide smoking cessations for people that wants to quit smoking. So, but we can only prescribe the patches, the nicotine patches, and the nicotine gum and the lozenges. We cannot prescribe the actual prescription medication for smoking cessation, but Alberta can, yes. So all the other scope of practice that we can do except independently prescribed, we cannot order lab tests or interpret lab tests, although we can look at your lab results and kind of give you some information, but we cannot order that at all. So we still have a few things to catch on.
You have a lobby group,
So I believe BCPHA has been doing work on that. Actually, the recent scope of practice change, BCPHA, I think they've been lobbying that for a while, but I think with the COVID, it kind of pushed it faster for us. So I think BCPHA has been doing a great job in trying to get those things expand for us. So, but
can you just go back that way
sure.
So and read it to us because it's too small for us.
Oh, sure, no problem. Let me see if I can.
I'd like to know what you can't do yet.
Whoops. So we cannot independently prescribe any prescription medication. This one in a collaborative practice settlement setting and agreement. That one I'm not sure what that is, but I think there are some clinics that has pharmacists on duty. So minor ailments and conditions, that's coming hopefully in spring. Smoking cessation, I mentioned. Emergency supply we can do. Therapeutic substitution, dose change formulations, we can renew and extend the prescription. Injections, so the expand of scope of practice allow us to do all kinds of medications already. We cannot order lab tests or interpret lab tests results. Regulated pharmacy technician, we do have that in BC now. Regulated pharmacy technicians is another part of the pharmacy team that can do a lot of things for us, except some of the duties a pharmacist will do. Okay. So at Rexall, we do have some of the various health programs that we provide that will help to manage your medical conditions. We have auto refill program. We have, so auto refill program basically is we automatically refill your chronic medications about 3 days before it's due. And so we'll get the medication prepared and ready for, and then once it's ready, then we'll notify you that it's ready to pick up. So it's a program certainly will help to improve adherence. So that way we'll make sure that you're taking your medication regularly the way it's supposed to be. We have, of course, we have medication reviews that we can do that any time of the day. We have compliance packaging, so we have they call them blister pack. Some of you may have seen it before. Especially important for people taking multiple medications. I have one patient that takes 16 medications a day, so the blister pack is full. When I lift it up, it's heavy. So you can imagine. All those pills, if you do it on your own, is not easy. We also have one called A1C testing. So A1C testing is especially for people with diabetes. So your doctors, people with diabetes, the doctor will prescribe an A1C test every 3 months or every 6 months, just to see how their diabetes is being controlled. We do a finger prick A1C test. And it takes 5 minutes, and it will give you your A1C test results. That will give you an idea how well your diabetes is being managed. It's free service. There's no charge whatsoever. You just phone us or come in, and we can do that for anyone. Yes.
Are pharmacists able to do an emergency supply of a controlled substance?
We can. So again, the pharmacist will look at your history. If something that you take regularly for a long period of time, we can certainly do that.
What if it's as needed?
And sorry, what was that again? If it's as needed. So again, we look at your history. If you feel that medication once every year, so it's something that I don't think that you'll be needing it immediately. So in that case, we probably will refer you back to your physician. But if something that you take chronically every day to control chronic pain, in case of you cannot get a hold of your doctor or anything like that, we can certainly help you with that as well. Yes, with the change of scope of practice, certainly help for us to feel more comfortable of doing that. Before that, pharmacists probably won't do that. But with the expanded scope of practice, I think pharmacists feel more comfortable of doing that because they've been putting the power to do that for you. Even though, like, if you know your pharmacist well and they know you take that medication long time, even if you ask them, they may not be able to do, before the expansion of the scope of practice, they may not be able to help you. But now I think they will be more willingly to do that for you. So lastly, of course, with all CARP members, you save 20% on every day on our Rexall brand products. So we have 8 Rexall stores in town, and then there's also a home healthcare store in town. I'm not sure if you folks have been to our home healthcare store. Home healthcare store is a store that they have pretty much everything. I shouldn't say everything, but anything you need for home healthcare, so they will have it there. And they have, if you have compression stockings, you can make an appointment and they can fit you for that as well. Yes. Okay, and I think with that, that will be I think that's the last slide for us. Whoops, sorry.
Okay. We'll do that.
Okay.
Thanks very much.
Questions?
There's an opportunity for questions now. I'm going to go back to the computers so I can see if there's some questions that have come in from the audience on the other side. But
yes, any questions that you have about pharmacy, if I can answer, I'm happy to help.
Maybe I can start off with one question, which is when you're doing the medical review.
Yes.
What if somebody has moved from Kelowna to Qualicum Beach, and,
yes,
you know, and now they're going to the pharmacist? Do you have their previous history of what prescriptions they've had? Can you use part of that during your review? What are the limitations there?
Yes, there's actually no limitation because PharmaNet, BC PharmaNet is your medication history is all in the BC PharmaNet. So we can see your prescription history for the last 18 months, actually. So we can draw the information from there and go through the medication review with you. Even though you haven't had prescription from that pharmacy yet, we can always get that information from PharmaNet and go over your medication with you. So it's no problem at all. Yeah. Yes.
Are you able to get back from Alberta to British Columbia? Back and forth?
You mean?
What you just talked about.
Oh, the medication. No, unfortunately, we can't access Alberta's medication history. No, so it will be only based on what you provide us. Yes, we can only do BC residents in terms of their medication history. Yes, I think Alberta has their own system, but BC PharmaNet been in place for, I don't know, 25 years maybe. Yes, so your medication history is there. Yes.
I just make a comment that if you get a question from the back, it may not be picking up well enough for those who are hearing on the broadcast. So you might want to just repeat.
Oh, sure. Okay, certainly. Yes.
Very helpful.
Yes, no problem. Yes, ma'am.
I'm just trying to remember what my question was. It was something, would it not be something that CARP or somebody, maybe the pharmacist can add, like, would it be useful to the pharmacist if you could read somebody's history from Newfoundland or whatever if they moved? Like,
yes.
like if you're in Alberta, a lot of Newfoundlanders moved to Alberta, you know, to work in the oil industry or whatever, and what happens when you go back and forth? Or if you're in BC or whatever.
So we will need the patients, like say if they are in Alberta, and I believe Alberta has their own medication review process. So if they've done the medication review in Alberta, and if they have that report, when they move to BC, once they settle down, and they can certainly bring that medication history with them to talk to the pharmacist. And we can certainly go over the medications again as well. Yes. Yes.
The thing that the pharmacists have that you can go in and find your prescription history, is that available to doctors and emergency room?
Yes. So the emergency rooms for sure. Yes, they can access that as well. Now, family physicians, I believe they have the ability to do that as well, but not all family doctors will go for that. Like they won't. I don't think they will go into the PharmaNet and look at unless they want to see anything in particular, then they will go over that. Yes, but the emergency room, yes, they have access to that for sure.
Because if you're in a rush to go to the ER,
yes,
you're always fumbling around trying to find a prescription.
That's why that medication review report is so important. You bring that along with you and say, here's my medication history. But of course, the emergency physician will still go over the PharmaNet system to make sure everything is up to date. Yes, yes, yes.
Don't you find that shocking that a doctor wouldn't check that?
No, because they have their own file.
Oh.
Because you have your folder when you go to see them. So unless they want to see, okay, I want to see if this patient been getting a different medication from a different doctor, they may go through the PharmaNet system, or they may just phone us and ask us to check. So you know, the physician will phone the pharmacy and say, I want to take a look at this patient's his medication history. So then we will have to enter into the PharmaNet system and say, okay, this medication he received from this doctor on what date. So lots of time we get calls like that from physicians to ask us to check.
I have one question. You mentioned that pharmacy assistants are part of the pharmacy team in those.
Pharmacy technician, registered pharmacy technician, yes.
Are there procedures in place to make sure that these things that you have described, they cannot be done by a pharmacy assistant, can they?
Oh yes, registered pharmacy technician have their own scope of practice, so they have limitations on what they can do and what they cannot do. Yes, yes.
It brings up a very good point, though, that if you're going to a cardiologist for a heart problem, they may not know that you've also gone to somebody else who's dealing with a kidney problem.
That's right.
And they wouldn't necessarily have that unless you tell them, or they're smart enough to think of, I should check everything else you've done and check with the pharmacist.
Again, that's why that medication review report is so important. If you go to see a cardiologist, bring that with you and let them have that. They may keep it. Actually, I have some patients say they kept my report. Can I have another copy? Say, okay, no problem. Or they make a copy. So that medication review certainly will help. But again, the communications between each different doctors is also very important. Yes.
I think it's also very relevant to mention that, you know, in different specialties, you have a lot of education about the drugs that deal with your specialty. So the cardiologist knows a lot about cardiac drugs. They don't necessarily know a lot that has to do with GI, you know, or neuro. Some do, some don't. And that's a bit of a difference to a pharmacist who looks at drugs as a grouping and then saying categories.
That's right. We yes, certainly we are like a big umbrella that covers everything. Of course, specialists they specialize on their own specialties. So we get calls from family physicians, ask questions, and we certainly help them whenever we can. Yes. Yes.
So as we age, if you've been on the same blood pressure medication, say for 20 years, would it definitely, you should have a review, because it's not likely that your requirements will be less as you're aging because your metabolism and everything is changing?
So in terms of blood pressure medications, so some medications, they will need blood test monitors. So your doctor, when you go see your doctor, maybe once a year at least, or 6 months. So they should be ordering blood tests to make sure you're monitoring your kidney functions or other electrolytes as well. Unless there's a dramatic change in your, like if you lose weight, if you lose 20 pounds, so the same dose that you take 5 years ago, you may not need it as much. So it depends, or same for diabetes. So again, I think the physician visit is important because they can follow up if there's any changes, they can make adjustments. Yes, certainly. Some people have been taking the same blood pressure medication for 10 years. The blood pressure is keeping well. Sometimes, and you have no side effects, the doctor will just keep you the same. They're not going to change anything. Unless there is dramatic changes that, as I mentioned, you lose weight, your blood pressure is lower than usual, then of course they will need to make adjustment. Yes. Yes.
And I have another question about the scope of practice.
Yes.
I'm a little disappointed that the scope of practice is not as great as I hoped that it would be. The pharmacists, do you feel the same way?
Well, as I said, we have certainly a few more things that we can improve on, but that depends on the legislation that we have. And again, I mentioned BCPHA. I think they're constantly lobbying for the changes, but I think it takes time. Like I think the scope of practice, I think they've been lobbying it for the last, 3 years, 5 years for the change. And as I said, because of the COVID, it probably pushed that a little bit faster. Yes. And also because of the shortage of physicians, because they try to ease off the pressure on the primary healthcare. They allow us to do more so that, whoever that may not have a physician will continue on their medications. As I said before, we want to make sure no one is worried about that not getting their medication that they need. Yeah.
Is it within the parameters of the pharmacist to question a doctor on a drug?
Oh yes,
yeah.
We do that all the time. We do that all the time. We see a prescription and say there's something not right. We will question. Yes. Oh yes. Yes. No, we always. I think pharmacist is the goalkeeper. Before they score.
And I think it's equally important for non-prescription drugs that the pharmacist would want to know that, and your individual prescription may not take into consideration interactions with the non-prescription drug. Certainly,
that's why medication review, because we won't know what vitamins you're taking. When you pick up your prescription, we won't ask you. But so medication review is a very comprehensive review to know all your medication that you're taking, and if there's any interactions, we can see it there. Of course, when you say, for example, if you're picking up an antibiotic for a 7-day course. And we know that this antibiotic cannot be taken with calcium, then we'll ask you then, are you taking calcium? And if you are, then we'll advise you how to take those two medications in different times. So that's just one instance, but with medication review, we will ask you all your vitamins, not just calcium. So then that way we can see if there's any interactions possible with your prescription medication and your vitamins and supplements. So, and these days, lots of people take vitamins and supplements. Some people will take 5, 6, 7 supplements, and they may be taking just 3 prescription drugs. Yes.
Yeah.
Very good.
Yes. Yes.
One last question.
So, yeah, my question is about the scope of work.
Yes.
So, and the interpretation throughout the different pharmacies and the pharmacists. So is it something extremely clear, or is it possibly, let's say if I was to go to a pharmacy, speak to a pharmacist, and they wouldn't want to take the responsibility to renew a prescription, whatever it was. So is it something that you're going to come up with an emotional judgment made by pharmacists in different stores? Or is it going to be very clear?
It's the scope of practice is very clear what we can do. But that's why that's another thing that I should say is that you should have a well established relationship with your pharmacist. It's very important that you know your pharmacist well and the pharmacist know you well, because if you come across with any issues like that, your pharmacists know your history and know what your medication history is, and they can make a judgment to help you.
So there is that intangible, the emotional judgment.
Because it depends. So if someone say that I've never seen before, and they come into my pharmacy and ask me to renew their I don't know, antidepressants, so that means I have to go through the history, how long they've been taking the medications, and whether it's stable. So if all those things are check marks, I should be theoretically renew the prescription for them.
So if somebody went and they didn't get you, and they got a very busy
Yes. Yes.
the pharmacist recognized you,
Yes.
and didn't know your background, it might be in their conscience to
Yes.
just say,
Yes.
call your doctor.
That's always can happen, unfortunately.
So there's that element.
Yes, unfortunately, that can always happen. But as a pharmacist, I think we will try to help whenever we can. But if the pharmacist doesn't feel comfortable, then of course they will refuse. Yes. So get to know your pharmacist. Yes, yes, very important.
That's a good place to cut off and say, your friendly physician might do the same, say 2 aspirins and call me in the morning, right? Anyway.
Okay, thank
I
you.
want to, first of all, thank you very much for, we end off the chapter meeting. Jeff, that was a very enlightening talk, and I think very helpful discussion as we work through some of the issues that are coming up. And I think we do need to push for more of those in BC that we see the Alberta group going to. It's an important part of what we're trying to do for the overall health as we age. And I think that's an important component of what we're trying to do here. So also to Michael, of course, and Eric for helping with the arrangements of getting Jeff here. And also to Francis Matheson, who is the lounge supervisor for this facility, to help us with the setup, and finally to Lynn and Brenda and Lynn's husband John for helping physically set up for today. And with that, just to remind you, the session has been recorded. If you had somebody who wished they could be here today but can't, you let them know that it'll be available on YouTube. We'll probably about a week from now, we'll have the information. It'll be on our Facebook page, and we should do that. The other is just that we've got 2 more hybrid meetings coming up. The next one will be April the 19th, again here, and broadcast. And the final one for this sort of spring year going into the summer will be on June the 21st. And so with that, read our newspaper, look at the information we have that's available, email us with any questions you've got, and thank you all for coming, and especially thanks to Jeff. Okay.
Hi, Michael from the